Welcome to the Cybersecurity Summit podcast at Summit Conversation. Hey, Wendy Meadley here, and I have more people behind the scenes where we're talking at the Cybersecurity Summit, and these folks are amazing MedTech folks talking about the intersection of cyber, med, and how we as medical professionals and the industry and solutions providers have to think about what we need to be thinking about to ensure everybody's data is safe, right? So
Absolutely.
Why don't you introduce yourselves and then just chat away.
Sure. Yan Kravchenko, I'm the Director of Information Security and Core Infrastructure at Hennepin Healthcare.
Okay.
Great. I'm Charlie Moen. I'm with Asimily. We're a proud sponsor of the MedTech seminar at this year's Cybersecurity Summit. So we do connected device cybersecurity for organizations like healthcare that have a lot of connected devices that are looking for visibility into everything, understanding what are potential vulnerabilities, and how do I prioritize that risk. So excited to be joined by these two IS leaders.
Yeah, thanks. I'm Sam Stevens. I'm the Information Security Director at Essentia Health. Been with Essentia for about a year and a half. We're a rural healthcare organization spanning across North Dakota, northern Minnesota, and northern Wisconsin, based out of Duluth, Minnesota.
So what's the conversation look like in that MedTech seminar room today? What are you guys facing over the next 12 months?
Yeah, it's fascinating. So some recent information just came out from the Ponemon Institute, and the stats are downright scary. So according to this study that they recently did, 92% of hospitals experienced an attack in the past 12 months.
Wow.
And the average health system was attacked over 40 times, which is incredible. Ransom payments are going up, and IOMT connected devices were the attack vector over 20% of the time. So it's a really important topic, and CIOs, CISOs are consistently ranking connected device security as one of their top 3 concerns. The average of the most expensive breaches at health systems was 4.7 million over the last 12 months. So it continues to be a very scary problem that I don't envy Sam and Yan and kind of everything they have to deal with and think through.
Yeah, well, when it comes to data privacy, and of course, like any organization, we're very concerned about PHI, protecting our patients' data. But for healthcare, and I know Sam can relate to this, there is another dimension to cybersecurity in that if we have an event and we have to switch to paper, we lose visibility at prior records, at information. We lose ability to use the tools clinicians use. There was actually a study done at the University of Minnesota level to show that in all of the ransomware events that impacted hospital systems specifically, there was as many as, I think they said, over 60 people that may have potentially died directly as a result of systems having to work on paper. Mm-hmm. So while without a doubt, when it comes to patient records, yeah, of course we care, but there is one level of risk even higher than that, and that is the ability for our system to stay open and continue relying on our connected devices and continuing to rely on tools and technologies that are now a critical part of providing care.
Yeah, I'd say that's I would agree with that 100%. I mean, that's one of the things that sets healthcare apart from other industries, at least most other industries outside of like military or things like that, is the fact that we're dealing with patients' safety concerns from a cyber perspective more than just financial records. While that's a significant concern, especially in the healthcare industry where most nonprofit healthcare organizations are struggling right now financially, so that's a concern. But beyond everything else, patient safety is number one. With any healthcare system, not just in cybersecurity, you talk to any healthcare professional, they're going to say patient safety is number one. So, and when we're talking about biomed devices, a lot of those are necessary to sustain life or to at least maintain a certain level of care. And if it drops off, if we lose access or whatever the case may be, people can die. Like you said, I think there was a Ascension, I believe was one that happened recently, and there was some articles that came out talking about how nurses were struggling to know what levels of medications patients needed and things like that because they tried to go to paper.
So that brings me, what you just said is, I hadn't really thought through that, and it becomes alarming as we start facing more climate change and systems going down and that kind of thing. How are you addressing those kinds of things? And
Well, I mean, a lot of people may not have been aware of, but even with the recent weather events that
Yes.
impacted Florida, there was a severe shortage of IV fluid. So to a point where there are procedures that ended up getting canceled. There were very significant concerns in making sure there is enough IV fluid to go around, even down to a point where, for example, I know our systems even looked into something as deep as changing the protocols and how much people can drink before a procedure, because we had to deal with the fact that we can't just give you that unlimited supply of IV fluids that would otherwise be available.
That makes sense.
So the supply chain is an incredibly critical part of that process, because again, as a hospital system, we rely on a very complex network of suppliers and providers and technology providers to do what we do.
And I think there needs to be a change in mindset of how hospital leaders on the operational side actually think about cybersecurity. So I think historically, at least from my experience, historically it's always been kind of, all right, well, from business continuity, disaster recovery, it's like, all right, what's our downtime that's allowable in 48 hours, right? If you look at any of these ransomware attacks, it's weeks that these systems are down. So this is changing the way that we need to look at this. So right now, at least at my organization, there's a big push from the CEO on down for business continuity in every area. And what are you gonna do if tomorrow your computer screen is blank and you have nothing? It's a really difficult question, and it's been one of our top priorities as an organization for probably the past 6 months, and every department is going through it. So, but the idea is that if we were to be in the same situation as an Ascension, which is kind of a similar, larger but similar type of organization as we are, it's a Catholic-based nonprofit healthcare organization that was hit by ransomware. So if we can go weeks without our IT systems and still provide patient care, or at least at a minimum not prevent patient safety concerns, we reroute them to other hospital systems or whatever the case may be, as long as we have those continuity plans in place, we're in better shape.
Yeah, it makes sense. One of the fascinating things I learned on the panel today was just third-party risk, how big a deal it is for both of you. And it was great to get both of your perspectives on just the number of third parties running around and kind of bringing in their own devices onto the network as well. Was a fascinating learning for me, and just how important that is, and kind of what keeps you two engaged with kind of every new third party that's being onboarded, and the amount of work that takes.
Yeah, for third-party risk management, it's not just what you're onboarding, it's also how do you know what you already have.
Sure.
And how are you renewing? How are you making sure that you have plans in place? If you do have to accept a risk, or you have to get the business to accept the risk, do you have justifications documented? Do you have procedures documented for plans of how you're going to remediate that risk eventually? Do you have compensating controls? And then, there's only so much you can do.
Absolutely.
Well, wow, I know we've got to get Yan back. He's on the stage, so we have a time crunch. I think we have 1 minute. And so, Charlie, can you help us understand why this moment of MedTech and cyber, in your perspective, why you wanted to get involved with the whole MedTech seminar?
Yeah. Well, first reason is Jan's very convincing.
Did he call you?
Yeah.
There you go. Well, thank you, Yan.
But no, it felt like a great event to be a part of. The chance to be the sponsor of kind of all this fantastic content. It really kind of the convergence of cybersecurity and healthcare is what we do, especially in the Minneapolis area that has so many health systems and kind of famous and smaller as well. It's been a great event for us, and a chance to talk with a lot of kind of healthcare information security leaders, people in biomed HTM roles, people that are actually wearing a tool belt and working on the devices as well as other people in the healthcare space, like people who are involved with manufacturing the devices, and had a lot of great conversations I would not normally have in the day-to-day on just how it all fits together, because we're really work closely with people like Yan, information security leaders, and we don't have as much visibility into, say, someone from Boston Scientific or someone from involved in the kind of supply chain of medical devices as well. So it's been fascinating for us, and I'm excited to go back after this and watch some more sessions.
So you got a deep dive.
Absolutely. Yeah.
Well, we're going to let you take them back in, teach them some more, and have a great day, you guys.
Great.
Thanks for joining us.
Bye-bye.
Thanks Thanks for joining us today at the Cybersecurity Summit podcast. See you next week. We invite you to join our CyberPro community on LinkedIn at Cybersecurity Summit.